All right, I'm going to start the meeting. This is a Board of Health meeting. The date is October 28th, 2024. Welcome, everyone. I'll go around and we'll do some introductions of my staff and the board. My name is Caroline Kinsella. I am the health director. I'm also a public health nurse. I worked at Mass General for 15 years as a nurse on the med-surg floors. So welcome, Mass General students. Emily?
Hi, everyone. I'm Emily. I'm the Assistant Health Director for Milton.
Roxanne?
Hi, I'm Roxanne Musto, member of the Board of Health. And as I had said before, I'm actually an adult nurse practitioner. I practice in geriatrics.
Mary?
Hi, I'm Mary Stenson. I'm the secretary on the board. I've been a nurse for a very long time, since I've been 21. I've worked in a MICU for 15 years. I've worked in vascular surgery. I've worked in the ER. Right now I work in the Boston Public Schools in a trauma-sensitive school. And I'm happy to be here on the Board of Health one night a month to service Caroline in her wonderful office.
Thanks, Mary. And we're missing one of our board members, Laura Richards, today. Usually there's 3 members of the board. So we're going to continue the meeting and take notes. This meeting is being recorded, and it will also be available after tomorrow on Milton Access TV. So just to let you know, it's all recorded. All right. So number 2 is approval of the meeting minutes. You get a chance to look at the meeting minutes from September 9th. Board?
Yeah.
Any questions?
Yeah.
I didn't see any typos or anything.
No, I thought they looked good.
Yeah.
Okay.
I'll make a motion then, if we're gonna do it. I'll make a motion that we approve the minutes from September 9th, 2024. Second?
A second.
I guess all in favor. Aye.
Aye.
Okay. So approved. Okay. The next one is number 3, citizens speak. I'm not sure exactly who's on the call here. We have 20 participants at least, but is there anyone here for citizens speak tonight? Hearing no one, we'll move along to number 4. It's discussion about opioid abatement funds and our upcoming workshop on October 30th, which is this Wednesday at the Council on Aging. A lot of this meeting tonight is going to be informative of what we're doing in the health department, but one of the things that we have taken on is opioid abatement funds. And Milton has received over $400,000 so far opioid abatement money. And the best way to find out how we're spending this money is to have a workshop and a survey and reach out to stakeholders and do focus groups to find out where we should be spending the money. And we're welcoming input from residents, and that's why we're holding our first workshop on Wednesday night to find out how we should be spending the money. One of the ways we are spending the money is we're going to be hiring a recovery coach, and the recovery coach is coming out of I have it right here. Riverside Community Care. So Riverside Community Care is going to be funding, we're going to fund a recovery coach. 6 towns are going to be using this recovery coach, hoping to start this in December. I don't know, board, if you have the chance to look at this. This is going to cost 6 towns $1,215.74 each month. And then we'll see how many Milton residents take advantage of this coaching, and we can reassess that in a year. But this is the first step. The state does want us to try to pool our money with other towns to use the funds. So this is the first step in pulling the money. And hopefully this will start in December with this recovery coach. And we also are going to do some Narcan training. We have some Narcan trainings coming up in January for the staff. And we're going to be dispensing Narcan in the office. So those are two of the ways that we're going to be starting to spend the money. But this is over it was a 30-year period that we're going to be getting monies from different companies with the opioid abatement fund. So it's going to be a long road, but we want to do it right. And we got about 20 people, I think, that are signed up so far. And we probably get a lot of walk-ins too. So we have Sky Price Cole, who's going to be leading the discussion, which is a facilitator. And yeah, looking forward to Wednesday night and coming up with some ideas. And we'll have to talk to the board to see what their plan is, if they wanted to do some kind of a grant process after we, reach out to the community to find out what they want. Maybe we can write a short grant. People can, in the schools or the police or even Council on Aging, they can apply for some monies to support some services. So the board can talk about that later, but I don't know if they want to do it like a once or twice a year grant process and how we're going to do that. We'll talk about that after we collect some more data. So we're looking for data and how best to spend the money. Roxanne or Mary, do you got any questions?
Yeah, quick question, couple questions. One is, so what towns are involved with the Riverside? And that's obviously it's in Norwood, so, right?
One in Norwood and one in Denton. I guess there's two Riversides. I can tell you, let me see, is it in this paperwork here? Norfolk County is 8 towns. 6 towns are going to be pooling the money. One town, Needham, has started their own shared service grant, so they're not in our shared service anymore. And I'm not sure who the other town is that is not able to also come into this program. Whether it's some towns are not, the money is not being managed by the Board of Health, so it's being managed by like select board members. So maybe they haven't even gone through the process of hiring anyone yet. So that last person might come on, that last town. So.
And then for the Narcan training, and you're giving out Narcan. So how many, how many vials or whatever, like injections of Narcan do you have?
We don't have any yet. We can get it from the Norfolk District Attorney's Office. I believe we can get it for free, but we want to go through the training first. So I'm going to do the training, and Sue. 3 of us are going to do the training. We've already done online training. We're going to do a 1-day training in person, and then we're going to be getting the Narcan and advertising it to the community. So if they want to come in and get some Narcan, then they can come into the office and we can tell them about Narcan and how to administer it and give it to them. So, yep.
And are we talking about are we doing a box too at the town hall?
Yep, we'll see. So we have a box, yep. We haven't put the box up yet until the Narcan training, and the training's in January.
Okay.
So, but anyone can come into town hall right in the front lobby and they can actually open up the box. It's called a SAM box, SAM box, and they can open it up. They could take the Narcan. There's directions in there on how to administer it. So they could do that, or they can come into the office. So it's there for public consumption. Yeah.
Okay, those are my questions. Thank you.
Yeah. Okay. Anything else, Mary?
No. No.
All right, so I'll move on to number 5. The community health assessment. So discussion of the release of the community health assessment and the upcoming rapid community health improvement plan workshop on January 15th, 2025 at the Nanderoni Center at BID Milton Hospital. So our first community health assessment was released in September, a 2-year process, gathering all that data, and learned a lot. And Milton Times did pick it up, which is great. And they ran a few articles, I think at least 3, and they're going to do 1 more article. So that's really great. There was some misinformation in one of the articles, and the right information was put into the second edition. So, yeah, so a lot of information trying to put that into the Milton Times, but we are looking forward to the community health improvement planning process. That's going to be in January. If you can put it on your calendars for January 15th at BID Milton Hospital. And Laurie Stillman is going to run that program, and hoping for community input for that. And yep, I just wanted to let you know about that coming up.
So Caroline, with the community health assessment, can you just back up for a minute and just, where did we end up sending the actual, finished product?
Where did we send it? I sent it to as many people as I could. I sent
So
it.
in the town, like you did the police, the fire,
Oh yeah,
all the departments pretty much or
all the
whatever.
department. Yep, all the department heads, town meeting members, news and announcements, superintendent. Yeah, far and wide, in the paper and on our website. Yeah.
And so as far as an official meeting to talk about it, we're just going to be going, we've already sent that out, so we're going to go with the improvement plan, correct? At
Yes.
this point, yeah.
Yep.
Okay.
So we still have a little bit of money of the ARPA funds to pay Laurie Stillman and to pay for some food for the program in January.
That's great.
Yeah. Okay, any other questions? Okay. All right, I'm going to move on to number 6, fiscal year 26 health department budget discussion and approval and capital request for a new electric car. So I actually presented the budget at our last meeting and it was approved. But since we've had our meeting, I did also go to the town administrator, Nick Milano, and finance director, Amy Dexter. And when I was talking about the budget with them also, we had Nurse Susan for 16 hours. We're requesting another 16 hours. And Nick said that he said we should put in for a full-time nurse. So put in for a full-time nurse for our public health nurse position. And so the budget changed a little bit. So he recommended that.
Good.
That'd be great.
That's super.
Yeah.
So that was the change from our last meeting.
Congratulations.
Yeah.
Well,
congratulations.
Through the warrant.
If it gets funded, right?
And, yeah, it wasn't funded last year. We also put in for a new electric car. Our electric car, our car right now is 15 years old. It's like about 26,000 miles on it, but it's old, showing its wear. And we have to order electric cars now. So last year we didn't get an electric car, and I put it in for the budget again this year. If we don't get it, I'll put it in for next year. So we do need a new car because, as I said, it's really showing its wear. So we'll see what happens with the budget.
Okay.
Okay. All right, moving along to number 7, discussion about potential expansion of the health department and letter to the select board members asking for a study of department space. I know we talked about this 2 or 3 months ago. Maybe it's more than that now. And I finally got the letter together. Did you have a chance to look at the letter, board? Do you have any changes that you'd like to make? Or do you want me to say I can read it out loud?
Sure.
Sure, ahead. Read it out loud for the.
Read it out loud. So it's to the select board members. So it's requesting more health department office space. So dear select board members, the health department and board of health would like to request a study of department office space needs and potential expansion of the health department. Over the past few years, the health department's roles and responsibilities have expanded, which includes the staffing needs of the department. Currently, the department has a total of 6 staff that work in the office and 2 staff that work in grant-funded positions remotely, but come into the office regularly to use the printers or discuss work plans. The amount of supplies and equipment has taken up every inch of the office, and a storage container contains overflow. Additionally, the community health social worker is consistently meeting clients down in the Baker room to protect resident privacy.
Mhm.
We respectfully request that you consider providing the health department with additional space to successfully serve the residents of Milton. So,
I think the
we've been
privacy
talking about a
issue is,
study. Go ahead.
you kind of have to have one, Caroline. They'll probably approve that. I'm hopeful because of the privacy issues and the increased issues that are going to be coming into the office with everything that's getting done. So they'll need to create like a safe space in a private space.
I hope so.
Hmm.
Recently, actually, Ann was bumped from the big room last week, and she went over to the fire department, but the doors weren't shut in the area she was working with clients. And she came back. She said, I didn't have my privacy, and I need privacy, and that's what she needs when she's seeing clients or residents. She wants to keep it private. It should be private.
Yeah.
I think that's really important. I think,
Yeah.
did you have a chance to talk with the town administrator a little bit about this? Because what they really need to do is look at all of the spaces, I think, and see what makes sense. If you're going to get more space, where it would be, or, part of the bigger picture with all the departments, what's going to make sense.
I agree.
And Caroline, could they circulate a Google Doc that has like an appointment grid on it, just so you can see who's using the room and other departments can see if you've got the room reserved, and Anne could have access to that document as well, because that's a good way, from my experience, to like efficiently use a space.
So we have to
Or-
contact Lynn DiNapoli whenever we're scheduling the space. So Ann works in close contact with Lynn upstairs in the select board's office to be able to schedule and reserve that space. I don't know what happened last week. We have a lot of
Yeah.
election stuff going on down in the basement right now. So
Mhm.
maybe that's why she was bumped. She hadn't never been bumped before, but she was bumped last week.
Okay.
So
That might have just been a one-time fluke kind of thing,
Yeah.
given that, the elections that, you can vote early and so forth. So I wonder if that's why.
True. Yeah.
Yeah.
Okay.
So yeah, with your permission, I'll send that letter to the select board.
Sure.
Great. All right, next up is number 8. It is the health director's report. I'm just going over a couple of things that happened last month. We did have a Milton Coalition meeting October 21st at the library. This was a 10-year celebration of the Milton, it's called the Milton Substance Abuse Prevention Coalition. Now it's called the Milton Coalition, but Vicki McCarthy and myself started the coalition 10 years ago, and here we are 10 years later.
Mm.
And so we had a little cake. We also had Sullivan's message, which was well attended. They spoke, it was, where it is here, presented by Taylor's mom, Kathy Sullivan, and Chris Sullivan. So it was actually pretty well attended at the library. It was a moving story about addiction, loss, and hope. It was about Chris Sullivan is former Patriot player. He spoke about Patriots and how he got addicted to medications. And then Kathy Sullivan spoke, and she spoke about her daughter, who was in high school, and she was a senior, and they were doing like Pride Week. And anyway, she ended up drinking alcohol, and she was out with like 20 plus friends, and she wandered away from the group, and she unfortunately she died of exposure and like falling into some water. I don't know if you remember that. I can't believe it's a number of years ago now, but I remember hearing about it. It's just a very sad story. And the message was like, don't drink, don't buy alcohol for young kids, and drinking and just telling that story. So it was very moving. It was very powerful. And they also spoke to the schools. So they went into the high school, and they said that they were very well received there at the high school. So this was paid for by the Drug Free Community Grant. But I'd like to have them again because they did a really great job.
Mhm.
Yeah. So
That sounds great. I'm sorry I missed that one.
yeah,
That's
I had
great.
another meeting that night too.
there were so many things, Roxanne and Mary too.
Yeah.
Yeah, so that was great. And as I said, we'll have them come again. Very
Yeah.
powerful. Yep. And then I went to Mike's 5K last Saturday. And this is the last event that they're doing. So Mike's 5K is in honor of Michael Mulcahy, who passed away from substance misuse, and the family, his mom Diane and family has put on a Mike's 5K road race walk for the past, at least I'd say 7 or 8 years. And we've directly been funded by this walk. They also give to a lot of other organizations, but they've also been generously giving us money for to the Milton Coalition for our programming. So we're going to miss this. And Gina and I walked Mike's 5K. So it was there was like hundreds of people there, hundreds. So a good send off on a positive note, but we've been funded by Mike's 5K, and we've been lucky to have that funding come in through the health department. So, and then the drug take back. So this weekend I staffed the drug take back at the police station staff, 10 to 2, Ann and I. And so that is twice a year. It's usually October and April, that collecting any unused drugs from residents. And I did bring some sharps containers too, because always somebody brings in some sharps. So collected a little bit of sharps, but didn't have as many people as past years. So kind of surprising. But it was interesting that this year they're actually going to be weighing how much medications came in for the drug take back specifically. So yeah, we have the kiosk there in the Milton Police Station, and anyone can drop medications there 24/7.
Caroline, do you think people
these days.
are using the police stations, the receptacle up there more often now?
Yes.
Every time I've been up there with just whatever, whether it's old Tylenol or whatever cough syrups or anything I have here, there's always someone coming out when I'm going in. It seems to be a busy, that receptacle is well used.
It is well used. You're right.
Yeah.
So
good.
I don't know if they're going to think about maybe dialing back the drug-free take back or the drug take back. Not sure why they were actually weighing the drugs this
Interesting.
year compared to other years, but we really didn't have a lot of people come.
Maybe that
So.
they sent it out to be incinerated, like in certain kilogram, like weights
Weight.
or something. They must have a requirement for like when they incinerate them or something. As far as batch
They're
weight
bringing it
or
to
something.
They're bringing it to the incinerator today. I mean, that day, Saturday, right
Okay.
after the drug take back.
Mm-hmm.
Yeah, they're
Okay.
taking it and weighing it and taking it. So we'll see.
Yeah.
Yeah. And then seasonal flu clinics. So we are finished with all our flu clinics. We had less than expected turnout, which was disappointing. We can't compete with CVS sending me texts that they're going to get $5 coupons.
I saw that. Yeah.
Yeah, they actually texted me this week. I'm like, oh my gosh, here you are texting again. So, yeah, so we had less people than we usually have. We use it's called a color platform when we are processing registrations. And I put in there this general pre-vaccination checklist into your packets because the CDC is now requiring us to answer these questions on the color platform. So these are 15 additional questions that we have to ask before we give the seasonal flu vaccine. And I can't tell you how frustrated I was to see this checklist. When we first started going over it, Nurse Sue Poirier is like, why are they asking all these questions? Because you can answer, it doesn't matter how you answer, yes or no. if you still answer yes to all the questions, you can still get the vaccine. So, some of the questions don't make any sense. One of them is the patient anxious about getting a vaccine? Why are you asking that question? It's just taking more time. So,
And what are you gonna do about it?
yeah, and even as I said, if you say yes, well, you can say, you can talk to them about that, but
Mhm.
it's just taking a lot more time to give a seasonal flu vaccine, where in the past, we didn't have to do all this extra work. And with the color platform, when people are checking in, it's not saving any of their information, their insurance information. So they're starting from scratch to put in all their information. Where if I walk into CVS or Walgreens, they'd have my information. CVS, that's where I get my prescriptions. They'd have me in the system, and they'd say, "You want your vaccine?" And that was it. Like it's not me putting in all that information. So it's just harder, I think, to get people to go into this platform and put all the information. And we did have some walk-ins. That was fine too. But again, it took a lot more time this year than it ever has for flu vaccines. I just want to let you know that.
Yeah, a lot of interesting questions about immune system. A lot,
Yes.
a
And
lot.
one of them, I actually called the state about this because I was really, I can't even tell you the word that I'm thinking about, how mad I was about it. Because when we do Maven and the virtual gateway, and we're following up on communicable diseases, if you had AIDS, we can't ask you if you have AIDS, and we can't
Right.
put it in any of our notes, even if I found out just by chance talking to you. But actually, one of the questions is about that here.
Mhm.
Do you have cancer, leukemia, HIV, or AIDS? What? And this is a public clinic. This is my frustration. You're at a public clinic, there's people all around you, and you're answering this
Right.
question in the public. And
Mhm.
why are you asking that question? It's intrusive, and we don't even ask it, as I said, in our Maven. We're not
And
allowed
it's
to ask it.
and it's not on an iPad, Caroline, right? It's just paper?
So it's all electronic. So we're
Okay.
asking it like in real time.
Oh, you are? Okay.
Yep.
So the
But
person isn't clicking
yeah, you
on it
can,
themselves.
we do have an iPad. Some people can fill it out themselves, but some people can come in and we're asking it verbally to them. And I did express my frustration about, well, that question in particular, because it doesn't matter if you have HIV, AIDS.
No.
It doesn't matter what you're answering. If you have it, you can still get the vaccine. So
Right.
why are
And
you asking that
you wonder
question?
what they're doing after all this is collected, like color health. Like what
Yes.
Right.
what body of like evidence-based,
CDC? But
like
why?
who's
Right.
yeah.
Why? Hmm.
Yeah.
I mean, I
So,
can see just some of the basic ones, like if you're feeling sick today, well, obviously
right,
you don't want someone getting it, or you have an egg allergy, or,
right,
you know,
Mhm.
something that you're allergic to one of the ingredients in the vaccine. That makes sense. That's what they've always asked. But like,
right.
this is like
Yeah.
very intrusive. I mean, and a little over the top. We don't ask these when we give them out to
And
our
we
most
can't,
vulnerable in the
right.
nursing homes. We don't even ask all
No,
this.
you don't
All
ask
we
them.
ask is, do you have an allergy, and a few of these other things. We don't ask any of this other stuff.
So
Right.
the
That's
CDC.
crazy.
CDC, that's
Yeah.
interesting that the
Yeah.
CDC uses a platform.
Mm.
Is it a private platform, Color Health?
It's a state platform.
Oh, it's a state.
Ah,
Oh, okay.
Yep. Yeah. So
Hmm.
I don't know what they're going to
interesting.
do next year, but they did have, you could go into some Zooms and talk about it. And I told them how I felt. And I'm not the only one, because there was a number of nurses on the call that
Yeah.
said,
Hmm.
it'd be different if you were asking for a specific reason, but there
Right.
was just no reason for it that I thought. But anyway, unless they're
Wow.
collecting data, but again, we're at a clinic where people can hear what your answers are,
Mhm.
and that's the problem.
Yeah.
But just to let you know. So yep. So
Great.
because we still have some vaccine left, Susan will continue to do the homebound. You might run some mini clinics in November and December.
How much do you have left, Caroline, around?
We have quite
And
a
how
bit
much
of
did you
stuff.
order?
We ordered less than last year. I think we ordered like maybe 600 doses.
Hmm.
But
Oh,
less
no.
than, I definitely
Yep.
decreased it from last year. And we do get the children's vaccine for free from the state.
Oh, that's good.
And,
And how many are you down to then?
so we probably got about, I'd say 150 or 200. The
Oh,
children's
wow.
vaccine, the children's vaccine we can give to a local pediatrician. So
Yeah.
I'll talk to Sue about that this week. So we've done our clinics now. Actually, yeah, we had so many more children come to the Pierce Clinic than we did last year. We had a lot more numbers. So we can actually bring that vaccine. We have in the past brought the vaccine to local pediatricians. But that's why we have to continue with the clinics because we still have vaccine, even though I didn't order as much. Yeah. So
You didn't do the high dose this year, right?
we always do the high dose.
Oh, you did?
Yeah.
Okay.
So we did give the high dose to 65 plus. So, all right. So to be continued about distributing vaccine.
Mm-hmm.
And then I just want to touch base about 152 Robin Street. My staff and I went out to see that it's called Common Sense Farm Market, just to find out exactly what has been built and what are their plans. And it has been built. It's kind of roughed out. They have 2 bathrooms and they have insulation inside. But I spoke to Mr. Johnson, who's kind of overseeing this project, to find out exactly what they're going to be selling there. And that's my question. So I was kind of under the impression that they were going to be having a farm stand. They have a lot of land there, farm. They're going to be selling vegetables. They're going to be selling fruits and vegetables at the farm stand. But it sounds like it's going to be more than that. They're going to be selling soups, salads, and baked goods and coffee. So I said, if you wanted to get a residential kitchen plan, you can make muffins and you can make brownies in the residential kitchen attached to the property. But if you wanted to, make these soups and salads and baked goods, he's applying for a food establishment plan. So I just have to clarify with inspectional services that this is what he's applying for, a food establishment plan, because they plan to make more than just, they're not selling just what they're growing there. It's going to be a larger operation. So I'm just trying to get clarification. When I spoke to him, he still hadn't submitted the required documents, so there's a plan review. And I, came into the office. We talked about what he needed. And I said, I need to know what you're going to be making too. So still trying to get some clarification around what is going to be sold there. And I need that in writing. So
So will they need a commercial kitchen,
no, they're applying for,
residential kitchen?
they're going to apply for, I believe, a residential kitchen where they can make their brownies and muffins. And they're applying to be a food establishment. So we don't have any commercial kitchens in Milton.
So I guess my question would be on that one. I know this went before the planning board,
Right.
so I think there should be some tie-in with what was actually approved. I don't know specifically what was approved, but I think, you'll need to talk with the planning department on that one. And then
already did,
also the
So
building department, but definitely the planning, because I know that went through planning.
that's correct. I talked to Tim Zawinski
Uh-huh.
and asked him, I told him exactly what has been brought forth.
Yeah.
And he said that he's going to talk to town council. So
Okay.
I have to just get a little bit more clarity about exactly
their
what's going to be
yeah.
sold there and what their plans are. They said they weren't going to have any stoves, but they're going to do a hot holding of soups. So I just try to get it in writing of what they're going to be serving.
Yeah.
And then we can move forward and kind of
Mhm.
trying to figure out, how many people might be served there.
Yeah.
And
The occupancy and parking
Yeah.
and
There is 7.
Hours.
Yep, there's 7 parking spaces. We got the hours, but I will bring it before you before we approve the hours. And the question too was, how many people are going to be there, like inside or out? So we did see some, a table and some chairs, but I didn't get any definitive answers yet. So we're still working on that application. I just want to let you know that.
Thank you.
We need
Thanks.
more specifications on materials and the plan menu.
Mm-hmm.
So that's going on there. And then my staff went out to El Barrios at Central Ave, and there was a food temperature excursion last month. I did speak to Laura Richards about this, and the refrigerator wasn't temping properly. I called the owner, and he just did not get someone to come in and fix it like we wanted, not as fast as we wanted. And so checked in again to make sure that the temperatures were reading correctly, and they weren't. So unfortunately, we had to dispose of some food. And so my staff went out and disposed of some food at that location. So
No.
it just wasn't temping properly.
Caroline, is that the same owner as when it was Madre Osteria? Is it the same?
No.
No. Okay.
Yeah. So we do have another restaurant, another El Barrios at Adam Street. Same owner there.
Oh, right.
Yeah, so we
Okay.
had 2 El Barrios, but now he has put a temperature log right on the refrigerator. So he's is it twice a day, Emily? I think it's twice a day he is recording the temperature.
Yeah,
So
he's doing it on the shift changes. So when they come in the morning and then when the afternoon shift comes on.
so a couple of more things that he needed to get fixed, and he did fix everything. So everything is back and operating the way it should be. But I just want to let you know that I did contact Laura, the chair, to tell her about that last month. So some food had to be disposed of.
Surprised they don't have a backup fridge for, if they run into a problem.
Yeah.
And how often are you going down to check that, like the validity of everything like he has the sign and he has the sheet on the fridge. And then when do you physically go down there next to check on things?
Do you have it on the schedule, Emily? It was a routine inspection.
Yeah, so they, I think, are risk level 3. So we go out 3 times a year there. So we found that on just a routine inspection. And then we went out 2 more times. I think the next time we'll be going is around December.
Yep. So that's the story with El Barrio. And then 7779 Hudson Street. So I don't know if you remember, in the summertime, there's problems at that address with the cooling unit, and then it is also tied into the heating unit. And we were working with town council, and 2 letters were sent to the owner, and I am happy to report that it was fixed. So we had to use town council to send letters. We were going to bring this to court because they said it was fixed. My staff went out, and it had been fixed maybe for 2 or 3 days, and then it wasn't properly fixed, and it went back to not working again. So this has been dragging on for a long time, and so now it's finally fixed. They have heat. So we're closing that case, 7779.
Do we have an update on 68 Smith?
I don't have any updates. I did look in,
Hasn't seen it.
I did look in Permanize today to see if anyone had submitted anything,
Mm-hmm.
and I didn't see anything. The director of inspectional services is going to be out for some time, so I wasn't able to contact him, but I didn't see anything in the queues for Permanize that they were submitting anything.
Okay, just wondering.
And that, that's condemned, and I sent the letter saying it's condemned. So, and then we put the signage up there saying condemned.
Okay.
Yep. I just want to mention that we are going to, my staff to MHOA. We do that every year. And it's in Springfield this year. It's November 13th to the 15th. And so we are staying one night down in the hotels, but we get CEUs for the conference, and it's an annual conference for health officers. So we are attending MHOA again this year. And then I just want to remind you about the Chapter 5 and Chapter 6 tobacco regulations, the proposed changes. I printed it out. I know Emily had put it into a document too. And if you guys, I don't know what the best is for you, if you want to fill out what you'd like to have changed or added, and then we can pick it up if you text me. I can come by your house and pick it up. And then we can have another meeting just to speak about any of the changes that you'd like. There's a lot of different tobacco regulations that they've added, like more statements of purpose and things like that we don't have in our tobacco regulations. And I don't know if you want to do it, like if 2 out of 3 of you want to explore expanding a regulation, then we could bring that up at the meeting, or we can go through each one at a time. So just something to think about.
I mean, I think
I
when we've
wanna
done it
approach that.
before, yeah, I mean, I think when we've done it before with any of the regulations, we sort of go through them all together, one at a
Yeah,
time, and
we
then
went through them
discuss.
one at a time.
Yeah, so maybe do that. That would be my thought on
Yeah.
it.
Okay.
Because then you could explain, like, you know, what should we really update this or think about it, or, you know, are we doing pretty good in this, you know, particular area right now?
That sounds great. Okay, so maybe we'll discuss that the next meeting. Another thing that I thought was going to come up this meeting but didn't, but I just wanted to put it on your radar, is that Kate Supton, she lives at 590 Harlan Street. She has 6 horses right now, and she'd like to increase that up. I don't know to how much. I think maybe 12, and she's thinking about maybe some goats too. But I said, you know, put together, I sent her all the information, told her she had to contact all her neighbors, fill out the application. So I kind of thought she might come tonight, but she is still working with the neighbors. And I just want to put that on your radar. That might be next
What's the
month.
name on that one?
Her
Kate,
name's Kate Supton. She's on Harland, 590.
Okay,
Yeah,
590,
we've
okay.
been inspecting her for a number of years, and everything has been fine, but she just wants to increase the amount of animals on her property. So just FYI.
Okay.
Is there anything else that you can think of?
No, I think that's pretty good. Very efficient meeting, Caroline. A lot of stuff in there.
A lot of stuff.
Wednesday night's meeting, you said is 5:30? Is that what you-
5:30 at the Council on Aging, and we're going to have pizza and salad too.
Oh, good.
We'll have
Okay.
a little something to eat and break out into groups and discuss ways that we can spend our opioid funds. So,
Okay.
we'll look to see when our next meeting date is. My phone.
Yep.
Mhm. Let's see, today's the 28th, so
It's only 4 weeks in November, so short month.
yeah.
I mean, compared to some of the months.
Thanksgiving is
Should
the
have it
20th.
like
Okay. Do you
December.
want to do December instead?
Yeah.
I mean, unless you think there's anything coming up, then it needs to be the end of November.
I don't know if there's any septic coming up. Emily, have you heard anything on septic coming up?
I haven't heard anything. I know Carolyn was talking with one of the old cases that we had been working with, I think before both of us started, but it doesn't seem like that's moving very quickly. So
Okay.
What were you
Alright,
thinking, Caroline?
Do you want to do December 2nd?
That's good.
The 2nd, or how is the 9th in case Laura can't make the 2nd? Is the 9th available for you guys too?
I'm not available on the 9th, I don't think.
Okay.
You want to start with the second and then see what she says?
Yeah. Yep. I'll send her an email tomorrow. See if she can do December 2nd for our next meeting.
And then if not, we can, we'll probably know fairly soon, and then we can maybe, if we had to go maybe the week, the week before is Thanksgiving week, so we could figure something out.
Did you want to do a Zoom again?
Yeah, sure.
Okay. All right, I'll talk to Laura about that. Okay, any other questions or anything?
I'm good.
Ready to adjourn at 7:50 p.m.?
Yay.
Sounds good to me.
All right, this is an early meeting.
I
That's
love
great.
it.
Yeah.
Thanks, Caroline.
Thanks, everyone. Thanks for coming.
Good
Thanks,
luck to the
guys.
students.
Yes, good luck to all the
students.
students that are on.
Thank you.
Thank you.
Thanks.
Thank you.
Good night.
Thank you.
Good night.
Good night.
Good night.